Autism. Navigating therapeutic approaches for autistic individuals. Therapeutic approaches. Tailored solutions for enhanced well-being. As an ally, it is essential to understand that therapeutic interventions for autistic individuals offer various approaches and strategies to support learning, development, and well-being. Applied approaches, tailored to their strengths, challenges, and goals, may include applied behavior analysis, ABA, cognitive behavioral therapy, CBT, developmental interventions, occupational therapy, OT, parent training and support, peer-mediated interventions, sensory integration therapy, social communication interventions, social skills training, speech and language therapy, supporting transitions and life skills, transitioning to adulthood, and post-secondary options. Applied behavior analysis, ABA, reinforced behavior modification. Applied behavior analysis, ABA, is a structured, evidence-based approach designed to understand and modify behavior by breaking down tasks, promoting positive behavioral changes by increasing preferred behaviors and decreasing harmful ones, tailoring interventions to individual needs and goals, targeting improvements in communication, social skills, academic performance, and daily living abilities, and using positive reinforcement. This approach helps achieve meaningful and lasting behavioral changes. The fundamental principles of applied behavior analysis, ABA, emphasize several essential aspects, including behavioral principles. ABA is grounded in the principles of learning theory, particularly operant conditioning. It analyzes precedents and consequences or events occurring before or after a behavior. Data-driven approach. ABA relies on systematic data collection and analysis to monitor progress and make informed intervention decisions, ensuring that behavior changes are measured objectively over time. Family involvement. Family involvement and training are essential to the ABA process. Families and caregivers can significantly support the individual's ongoing progress by ensuring the proper application and reinforcement of ABA techniques outside of therapy sessions. Focus on positive reinforcement. Positive reinforcement is a central strategy in ABA. It increases desired behaviors by providing rewards or praise, enhancing the likelihood of repeated behaviors. Generalization and maintenance. ABA aims to ensure that the skills learned are applicable in one setting, transferable to other environments, and sustained over time. Individualized and person-centered. Each ABA intervention is customized to cater to the individual's specific needs, strengths, and challenges, focusing on improving the person's quality of life and independence. Reduction of challenging behaviors. ABA addresses challenging behaviors by understanding their underlying functions and developing strategies to decrease or replace them with more appropriate alternatives, fostering a sense of hope and optimism. Skill building. ABA seeks to teach new skills, such as communication, social interactions, play, academics, and daily living activities. ABA interventions can be implemented in different settings, such as homes, schools, clinics, and community environments. These interventions are typically conducted by behavior analysts, board-certified behavior analysts, BCBAs, or behavior technicians trained in ABA principles and techniques. Applied behavior analysis, ABA. Legitimate concerns and criticisms. While ABA has been effective for many autistic individuals, there are ongoing discussions and debates within the autism community about certain ABA practices and the need for an ethical and person-centered approach to intervention. Concerns about the application of ABA therapy highlight several significant criticisms and unfavorable impressions, including some autistic individuals and their families consider ABA abusive. Historical ties to punishment-based techniques raise concerns about its impact on mental well-being. The high intensity and cost of ABA programs may create barriers to access for some families. Insufficient attention to individual autonomy and choice can restrict personal growth and development. Prioritizing normalization over embracing neurodiversity may overlook the unique strengths and perspectives of autistic individuals. Limited generalization of skills learned in ABA sessions to real-life situations may reduce the therapy's long-term effectiveness. And the rigid, compliance-focused approach of ABA therapy may limit individual expression and autonomy. As with any intervention, it's essential to consider the individual's unique needs, preferences, and well-being in delivering ABA services. Cognitive behavioral therapy, CBT. Shifting negative thoughts to positive mindsets. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach for autistic individuals. It focuses on understanding and managing thoughts, feelings, and behaviors by utilizing the following. Anxiety management. CBT techniques help individuals identify and manage anxiety symptoms, including relaxation techniques, cognitive restructuring, and gradual exposure to feared stimuli. Behavior modification. CBT aims to modify problematic behaviors and promote more adaptive coping strategies through reinforcement and exposure. Cognitive restructuring. CBT helps individuals recognize and challenge negative or distorted thoughts and beliefs, promoting more adaptive thinking patterns. Collaborative approach. CBT is a therapy that values the input and participation of both the therapist and the individual. Together, they set goals, develop treatment plans, and implement strategies, fostering a sense of shared responsibility and progress. Emotional regulation. CBT teaches individuals strategies to identify and regulate emotions, including mindfulness exercises, emotion labeling, and coping skills training. Exposure and desensitization. In cases of anxiety disorders, phobias, or PTSD, CBT may use exposure techniques to confront fears and reduce anxiety over time gradually. Homework and skills practice. CBT often includes homework assignments and skill-building exercises that individuals practice between therapy sessions to reinforce learning and progress. Individualized treatment plans. Individualized treatment plans meet each individual's unique needs and goals, with therapy sessions focusing on specific areas of difficulty and building on strengths. Parent training. CBT may involve training parents or caregivers in CBT techniques to support their child's progress and generalize skills learned in therapy to the home environment. Problem-solving skills. CBT helps individuals develop problem-solving skills to address challenges and navigate daily situations effectively. Social skills training. CBT interventions often include training to help individuals improve their ability to navigate social situations, understand social cues, and develop practical communication skills. CBT can be used to treat common coexisting conditions, including anxiety disorders. CBT targets anxious thoughts and behaviors, teaching individuals coping skills to manage anxiety effectively. Depression. CBT helps individuals challenge negative thoughts and replace them with more positive and constructive thinking patterns. Eating disorders. CBT targets distorted thoughts and beliefs related to body image, food, and weight. Obsessive-compulsive disorder, OCD. CBT addresses obsessions and compulsions, helping individuals develop more adaptive responses. Phobias. CBT employs exposure techniques to gradually confront and desensitize individuals to their fears. Post-traumatic stress disorder, PTSD. CBT is used to process traumatic experiences, challenge distorted beliefs, and reduce symptoms of PTSD. And substance use disorders. CBT assists individuals in identifying triggers, developing coping strategies, and building relapse prevention skills. CBT is conducted through structured and time-limited sessions tailored to each individual's needs and concerns. This practical approach makes it an effective and focused treatment option for various mental health challenges. CBT can be particularly beneficial for autistic individuals, helping them identify and challenge negative thoughts and behaviors while learning coping strategies to manage anxiety or stress. Cognitive behavioral therapy, CBT. Legitimate concerns and criticisms. Critics of cognitive behavioral therapy, CBT, for autistic individuals highlight several concerns, including focus on conformity. CBT's emphasis on conforming to societal norms may conflict with the neurodiversity paradigm, which advocates for accepting and celebrating neurodivergent traits. Challenges with generalization. Skills learned during CBT sessions may not always transfer to real-life situations, limiting the therapy's long-term effectiveness in addressing everyday challenges. Lack of individualization. CBT interventions may not adequately account for the individual differences and unique needs of autistic individuals, leading to a one-size-fits-all approach that may not fully address their specific concerns. Limited applicability. CBT may not be suitable for all autistic individuals, especially those with significant communication or cognitive impairments, due to its reliance on verbal communication and abstract thinking skills. Narrowed focus on sensory issues. CBT may not effectively address sensory sensitivities commonly experienced by autistics, potentially overlooking significant sources of distress and anxiety. Need for adaptation. Critics suggest that therapists should adapt CBT interventions to accommodate the needs and preferences of autistic individuals, such as incorporating visual supports and alternative communication methods. And rigidity and structure. The structured nature of CBT may be perceived as overly rigid by some autistics, leading to resistance or disengagement from therapy. Developmental interventions. Nurturing foundations in early development. Developmental interventions include strategies, therapies, and approaches to support and enhance early development in children with developmental delays, disabilities, or those at risk for physical, cognitive, social, emotional, or communication challenges. They focus on building foundational skills, such as joint attention, imitation, and play skills, essential for later development and learning. Key features include early intervention. Early developmental interventions are crucial for promptly addressing developmental concerns. Research has shown that they improve outcomes for children with developmental delays or disabilities. Evidence-based approaches. Effective developmental interventions are grounded in robust research and evidence. These interventions are continually evaluated and updated to align with the latest findings in developmental science. Individualized and family-centered. Developmental interventions are tailored to each child's unique needs, strengths, and challenges, actively engaging and supporting the child's family throughout the intervention process. Multidisciplinary collaboration. Developmental interventions often involve collaboration among professionals, including pediatricians, psychologists, speech-language pathologists, occupational therapists, physical therapists, and educators. This collaborative approach ensures comprehensive support and services, as the child and their family benefit from a team of experts working together. Common developmental interventions include applied behavior analysis, ABA. ABA teaches and reinforces positive behaviors, improves social skills, and reduces challenging behaviors in children with autism and other developmental disorders. Early childhood education programs. High-quality early childhood education programs, such as preschools and daycare centers, can provide structured learning environments that support early development and school readiness. Early childhood intervention programs. Early childhood intervention programs provide comprehensive services, including therapies, developmental assessments, and family support, to children with developmental delays or disabilities. Occupational therapy. Occupational therapists focus on promoting independence in daily living skills, fine motor skills, and sensory processing. Parent training and support. Parent training programs offer parents guidance and strategies for effectively supporting their child's development and addressing specific challenges. Physical therapy. Physical therapists address motor skills, strength, balance, and coordination challenges. Play-based interventions. Play-based interventions utilize play to promote various aspects of development, such as communication, social skills, and emotional regulation. Social skills training. Social skills training programs help children learn appropriate social behaviors and improve their ability to interact with peers and adults. Speech-language therapy. Speech-language therapists work with children to improve communication skills, language development, and social communication. These developmental interventions aim to give children the tools and skills to reach their full potential and lead fulfilling lives. Addressing developmental challenges early and offering comprehensive support can significantly improve the child's development and overall well-being. Occupational therapy, OT. Unlocking independence through targeted interventions. Occupational therapy, OT, is a specialized field dedicated to helping individuals of all ages and abilities by building essential skills, boosting independence, and improving the overall quality of life. Therapists use a comprehensive and holistic approach to address a range of needs with techniques, including activities of daily living, ADLs. Occupational therapy takes a personalized approach to assist individuals in developing the necessary skills to perform activities essential for daily life, such as dressing, eating, grooming, bathing, and toileting. Cognitive skills. Occupational therapy may target cognitive skills, including memory, attention, problem-solving, and organization, to enhance overall cognitive functioning. Environmental modifications. Occupational therapists assess living and work environments and recommend adaptations and modifications to support independence and accessibility. This assessment involves observing task performance, discussing goals and challenges, and considering physical and cognitive abilities. Based on the assessment, the therapist develops a personalized intervention plan. Fine motor skills. Occupational therapy targets fine motor skills, including hand dexterity, handwriting, manipulating small objects, and using utensils effectively. Gross motor skills. Occupational therapy improves gross motor skills, such as balance, coordination, and mobility, to enhance movement and physical abilities. Sensory processing. Occupational therapy addresses sensory processing difficulties, helping individuals effectively process and respond to sensory information from the environment. Social skills. Occupational therapy may support the development of social skills, such as turn-taking, eye contact, and communication, to improve social interactions and participation. Visual perceptual skills. Occupational therapists work on visual skills, such as visual tracking, scanning, and depth perception, which are essential for reading, writing, and other visual tasks. Occupational therapy supports individuals with various conditions, such as developmental delays, physical disabilities, neurological disorders, mental health issues, and age-related challenges. It empowers them to engage in meaningful and essential daily activities, fostering independence and enhancing overall well-being. Occupational therapists provide various techniques and interventions tailored to the unique needs of their clients in diverse settings, including hospitals, clinics, schools, rehabilitation centers, and private practices. These include adaptive equipment and assistive devices. Therapists recommend and provide training on using devices that enhance independence and functionality in daily activities. Environmental modifications. Changes to the physical environment are implemented to improve accessibility and foster autonomy. Sensory integration therapy. This approach addresses sensory processing issues by offering sensory-based activities, helping clients better regulate their responses to sensory stimuli. Task analysis. Therapists break down complex tasks into smaller, more manageable steps, making it easier for clients to develop the necessary skills. Therapeutic activities. Clients engage in meaningful and purposeful activities to enhance specific skills and encourage independence. Parent training and support. Empowering families with knowledge, skills, and resources. Parent training and support programs provide parents and caregivers with the knowledge, skills, and resources to better understand and support their child's unique needs and development. Additionally, these programs allow parents to become effective advocates and educators for their autistic children, instilling a sense of empowerment and confidence. Standard training and support programs include advocacy and IEP support. Parents receive information on their rights as advocates for their child's educational needs, including support in developing individualized education plans, IEPs, and securing appropriate services in academic settings. Applied behavior analysis, ABA, parent training. ABA-based parent training programs provide parents with techniques and strategies used in ABA therapy. Parents learn how to reinforce positive behaviors, manage challenging behaviors, and implement interventions to promote their child's communication, social skills, and daily living skills. Communication training. Communication training for parents is a powerful tool. It focuses on teaching parents methods to improve their child's communication skills, including augmentative and alternative communication (AAC) systems if necessary. This training empowers parents with a deeper understanding of their child's communication needs, giving them greater control and confidence in their ability to support their child. Online parent training resources. Online platforms and webinars, such as Ally Solutions educational classes, allow parents to access training materials, videos, and resources related to autism and parenting strategies. Parent coaching. Parent coaching involves individualized support from professionals, such as certified behavior analysts or special education teachers, who work closely with parents to address specific concerns and challenges in their child's development. Parent-mediated interventions. These interventions involve training parents to deliver specific therapeutic techniques or strategies to their child in the home setting. Examples include the Early Start Denver Model, ESDM, a comprehensive behavioral early intervention approach for autistic children, and Pivotal Response Treatment, PRT, a naturalistic and play-based intervention that targets pivotal areas of a child's development. Parent support groups. Parent support groups are a place where parents of autistic children can come together. These groups foster community, allowing parents to share their experiences, offer emotional support, and exchange helpful strategies. They provide a safe space where parents can feel understood and supported. Positive behavior support. Parents learn about positive behavior support strategies, which emphasize rewarding desired behaviors and implementing consistent consequences for challenging behaviors. Sensory integration strategies. Parents receive training in understanding sensory processing challenges and creating sensory-friendly environments and activities that support their child's sensory needs. Social skills training for parents. Parents participate in social skills training programs, where they learn strategies for teaching and reinforcing social skills in their children. They may also learn to facilitate social interactions and play between their child and peers. Parent training and support programs recognize parents' critical role in their child's growth and development. By equipping parents with evidence-based strategies and empowering them with knowledge and resources, these programs aim to improve the well-being and outcomes of autistic children and their families. Peer-mediated interventions. Building social bridges with understanding, support, and friendship. Peer-mediated interventions involve training peers to interact with and support autistic individuals in social situations, fostering inclusive and supportive environments. These interventions aim to enhance social inclusion, improve social communication, and promote positive interactions between autistic individuals and their peers. Through this process, peers learn to be supportive, understanding, and inclusive, creating opportunities for meaningful social interactions and friendships. Key features of peer-mediated interventions include adult facilitation. Adults, such as teachers, therapists, or facilitators, guide and support social interactions, ensuring peers and autistic individuals have positive experiences. Modeling and role-playing. Peers receive training through modeling and role-playing, observing and practicing appropriate social behaviors in a structured setting. Naturalistic settings. Peer-mediated interventions occur in natural settings, such as classrooms, playgrounds, or community environments, where social interactions naturally happen, building empathy and acceptance. Promoting inclusion. Peers are encouraged to invite autistic individuals into social, group, and play activities, fostering a sense of belonging. Reinforcement of positive interactions. Positive reinforcement and praise are given to autistic individuals engaging in social interactions or using new social skills. Social skill development. Peers learn social communication strategies, including initiating conversations, using precise language, maintaining eye contact, taking turns, and including others in activities. And training, typically developing peers. Peers receive specific training and guidance on interacting effectively with autistic individuals, helping them understand their unique characteristics. Benefits of peer-mediated interventions include generalization of skills. Social skills learned through peer-mediated interventions may generalize beyond the intervention setting, improving social interactions in various contexts. Improved social communication. Peer-mediated interventions can improve social communication skills in autistic individuals as they receive more opportunities to practice social interactions in natural settings. Increased social inclusion. By training peers to be understanding and inclusive, autistic individuals are more likely to be included in social activities and have positive social experiences. And positive peer relationships. These interventions can foster positive relationships between autistic individuals and their typically developing peers, promoting social support and friendship. Sensory integration therapy. Understanding and responding to sensory challenges. Sensory processing describes how our nervous system handles sensory information from the environment, such as touch, sight, sound, taste, and movement. Some individuals, including autistics, may have difficulties processing sensory information effectively, leading to sensory sensitivities or sensory-seeking behaviors. Developed by occupational therapist Dr. Jean Ayres, sensory integration therapy helps individuals with sensory processing difficulties by using the principles of sensory integration theory to enhance organization and response to sensory input. Key strategies include adaptive responses. Through repetitive and targeted sensory experiences, individuals learn to adapt to sensory challenges, improving self-regulation and coping skills. Gradual challenges. Therapists carefully increase the difficulty and intensity of sensory experiences as individuals become more comfortable and responsive to them. Individual-led approach. Often child-led, this therapy involves the therapist closely observing the individual's reactions and preferences, tailoring activities to suit their specific needs and interests. This process assures the individual that their unique challenges are addressed. Play-based interventions. Play is a central component of sensory integration therapy, as it allows the child to explore and engage in sensory experiences naturally and enjoyably. Sensory assessment. Before beginning therapy, the individual undergoes a comprehensive sensory assessment to identify specific sensory processing challenges and individual differences. Sensory exposure. During sessions, individuals are introduced to various sensory experiences in a structured setting. These experiences, carefully selected by the therapist, may include textures, movement activities, tactile sensations, auditory stimuli, and visual inputs, providing a comprehensive sensory experience. Occupational therapists with specialized training in sensory integration theory and techniques, offer personalized sensory integration therapy in supportive environments filled with sensory experiences. Sensory integration therapy addresses each individual's unique sensory needs and goals, enhancing sensory integration and organization to improve attention, motor skills, emotional regulation, and participation in daily activities. This therapy can be especially beneficial for individuals with sensory processing difficulties, helping them navigate and respond to sensory stimuli more effectively and adaptively. Social communication interventions. Effective approaches for improved interaction and communication. Social communication interventions are a group of therapeutic approaches and strategies aimed at improving the social communication skills of autistic individuals. Targeting various aspects of social interaction and communication, these interventions include group social skills training. This approach provides a supportive and structured environment where individuals can practice social skills with peers, facilitating social interaction and applying these skills across different settings. Joint attention interventions. These interventions target joint attention skills, which involve sharing attention with others, such as following someone's gaze or pointing to share an interest in an object or event. Mindfulness and emotional regulation. Incorporating mindfulness and emotional regulation techniques helps individuals manage their anxiety and emotions in social situations, contributing to better communication outcomes. Peer-mediated interventions. These interventions train peers or classmates to interact with and support individuals facing social communication difficulties, fostering understanding, inclusion, social connections, and friendships. Social skills training. Through role-playing and modeling, individuals learn specific social skills such as initiating and maintaining conversations, making eye contact, understanding nonverbal cues, and interpreting social scenarios. Social stories. Narrative-based interventions that describe social situations, social cues, and appropriate behaviors help individuals with social communication challenges understand social expectations and respond appropriately in different situations. Social thinking. Developed by Michelle Garcia Winner, this approach enhances social awareness and interaction by teaching individuals to understand and navigate social thinking processes. Technology-based interventions. Technology, such as social skills apps or virtual reality programs, can create engaging and interactive environments for practicing social skills. Video modeling. By observing video examples of desired social behaviors, individuals, particularly visual learners, can effectively mimic and practice these skills. Social communication interventions are administered by professionals with expertise in communication and interaction, including speech-language pathologists, occupational therapists, psychologists, and educators. These interventions are customized, assessed, and refined to suit the individual's age, developmental stage, and specific communication challenges, ensuring they meet their changing needs and goals. Social skills training. Building confidence through enhanced communication. Social skills training is a structured and systematic program that enhances an individual's ability to interact and communicate effectively in social situations. It is commonly used as an intervention for individuals facing challenges with social interactions, including autism, social anxiety disorder, or other social communication difficulties. Often integrated into a comprehensive treatment plan for individuals with social communication challenges, social skills training aims to improve social competence, self-confidence, and overall social functioning by facilitating increased social participation and positive interactions. The methods used in social skills training are customizable to meet each participant's unique needs and developmental level, making it a flexible and adaptable intervention suitable for individuals with various social challenges. Its primary objectives include building social awareness. Building social awareness helps individuals understand social cues, body language, and nonverbal communication to recognize others' emotions and intentions. Developing social communication. Developing social communication teaches practical communication skills, including initiating and maintaining conversations, active listening, and turn-taking. Enhancing social problem solving. By enhancing social problem solving, individuals identify and resolve social conflicts or challenges in various situations. Fostering empathy and perspective taking. Fostering empathy and perspective taking encourages individuals to understand others' feelings and viewpoints by promoting empathy and understanding. And managing social anxiety. Managing social anxiety addresses anxiety related to social situations and provides coping strategies to reduce social discomfort. Therapists conduct social skills training in various formats, including individual sessions, group therapy, or as part of a structured social skills program. Training often involves a combination of instruction, role-playing, modeling, and real-life practice to reinforce learned skills. Standard components of social skills training include feedback and reinforcement. Participants receive constructive feedback from the trainer and peers, encouraging positive changes in behavior. Generalization. Skills learned in training are applied and practiced in real-life settings to promote generalization to natural social situations. Instruction and explanation. The therapist provides information about social norms, appropriate behavior, and communication skills. Modeling. The therapist demonstrates proper social behaviors and communication, serving as a positive example for the individual. And role-playing. Participants practice social interactions in a safe and supportive environment, taking on different roles to learn and refine their skills. Speech and language therapy. Unlocking communication through enhanced social interaction. Speech and language therapy is a specialized field focused on assessing, diagnosing, and treating communication and swallowing disorders. Led by speech-language pathologists, SLPs, or speech therapists, the primary goal is to enhance an individual's abilities in speech production, language comprehension, and social communication. Speech and language therapy targets the specific needs of each individual, helping them achieve improved communication success and overall well-being. Common areas addressed include articulation and phonological disorders. SLPs work with individuals with difficulty producing speech sounds correctly, helping them improve articulation and phonological skills for more precise speech. Augmentative and alternative communication, AAC. For individuals with severe communication impairments, SLPs may introduce and support the use of AAC systems, such as communication boards, picture-based systems, or speech-generating devices, to facilitate effective communication. Feeding and swallowing difficulties. Speech and language therapy helps with feeding and swallowing difficulties by strengthening the muscles and teaching specific techniques to improve safety and efficiency. Additionally, it may involve dietary modifications and behavioral strategies to prevent choking and aspiration, ensuring proper nutrition and hydration. Fluency disorders. Speech and language therapy may address fluency disorders, such as stuttering and rhythm difficulties, helping individuals improve their speech fluency and prosody for greater clarity and natural communication. Language delays and disorders. Speech therapy targets individuals with language delays or disorders, focusing on enhancing their ability to understand and use language. This includes developing vocabulary, grammar, comprehension, and expressive language skills. Pragmatic language skills. SLPs address pragmatic language skills, which are essential for appropriately using language in social contexts. These skills include nonverbal communication, turn-taking, initiating and maintaining conversations, and interpreting social cues. Voice disorders. For individuals with voice disorders, speech therapy aims to improve vocal quality, pitch, and hygiene, ensuring healthier and more effective voice use. Speech and language therapy is crucial in improving communication and swallowing abilities, significantly enhancing an individual's overall quality of life and participation in daily activities, education, and social interactions. This ongoing process is provided in various settings, such as schools, clinics, hospitals, and private practices. Therapy is tailored to each individual's needs, using a methodology that includes assessing abilities, diagnosing issues, setting achievable goals, providing home practice exercises, and monitoring progress. This continuous approach ensures effective intervention, long-term communication, and improvement of swallowing skills. Supporting transitions and life skills. Empowering autonomy through tailored guidance. Supporting autistic individuals through transitions and life skills development is essential for helping them navigate various life situations and achieve greater independence. Tailored assistance, guidance, and skill-building opportunities are crucial in this process. Effective strategies include collaboration with professionals. Working with educators, therapists, and other professionals ensures a consistent and comprehensive approach to addressing transitions and life skills. Community involvement. Community activities foster social interaction and familiarize individuals with local resources. Functional communication training. Teaching effective communication methods, including AAC systems, enables individuals to express their needs and preferences more clearly. Independent living skills. Introducing and gradually increasing responsibility in cooking, cleaning, and budgeting promotes self-sufficiency. Individualized transition planning. Customizing plans to align with an individual's needs and preferences smooths the transition to new environments or life stages. Patience and positive reinforcement. Regular encouragement and celebrating small achievements are vital for building confidence and motivation. Self-regulation strategies. Teaching techniques such as deep breathing and sensory management help individuals handle emotions and stress effectively. Social and recreational activities. Participation in activities that match personal interests encourages social interaction and skill development. Social skills training. Focusing on appropriate social behaviors enhances communication and the ability to build relationships. Task analysis. Breaking down complex tasks into smaller, manageable steps facilitates learning and skill acquisition. Visual supports and schedules. Using visual aids reduces anxiety and helps individuals anticipate and prepare for changes. Vocational training and job skills. Providing vocational training and job skills prepares older individuals for employment opportunities, enhancing their independence. Each personalized strategy considers the individual's strengths, challenges, and developmental stages. When combined with patience, consistency, and positive reinforcement, this person-centered approach is critical for fostering successful transitions and life skills development in autistic individuals. Transitioning to adulthood. Guiding post-secondary options for autistic individuals. Transitioning to adulthood presents significant challenges for autistic individuals, as it involves moving from the structured environments of childhood and adolescence to greater independence and adult responsibilities. Successful transition requires thoughtful planning and robust support. Key considerations include community-based programs. These programs offer day activities that foster social engagement, vocational training, and independent living skills development for young autistic adults. Independent living skills training. This training equips individuals with essential life skills such as managing finances, cooking, cleaning, and using public transportation. Individualized Transition Plan (ITP). The ITP documents specific goals, services, and supports for a successful transition. It includes post-secondary education or employment goals, independent living, social skills, and communication. Post-secondary education options. For those pursuing higher education, options include colleges, universities, trade schools, or vocational programs. Some institutions offer specialized support services for students with disabilities, including autism. Social inclusion and community integration. Engaging in social activities, joining clubs, and participating in community events helps build social connections and a sense of belonging. Social skills training. This training is crucial for navigating social interactions and relationships in various settings. Supported employment. These programs provide job coaching and ongoing support in integrated work settings, assisting with job training, workplace accommodations, and social skills development. Transition planning. Planning often starts in the early teenage years, involving collaboration among educators, parents, therapists, and other professionals to identify goals, strengths, and needs. Transition support services. These services may include counseling, guidance, and help accessing community resources to achieve post-secondary goals. Vocational training programs. Vocational training programs, internships, or apprenticeships provide hands-on training and skill development to prepare individuals for the workforce. Remember, transitioning to adulthood is an ongoing process, not a single event. Flexibility, continuous support, and collaboration with various professionals are vital for a successful transition. Parents, caregivers, educators, and support professionals are crucial in guiding and empowering autistic young adults to reach their full potential and lead fulfilling lives.